Wellness Wednesday, brought to you by BioStrath. Get what you need naturally.
All men are at risk for prostate cancer, but some are at risk of having it spread to other parts of their bodies. This is where prostate-specific membrane antigen PET imaging can be an invaluable tool in fighting the disease. Now available at Alexandra Imaging, the technique uses a tracer that highlights the prostate-specific membrane antigen that shows up on a PSMA PET-CT, regardless of where they are in the body. In simple terms, it goes into the body, finds these prostate cancer-specific cells, and illuminates them for the scan. Speaking at the launch, urologist Dr. Hassan Khan says this is a superior technique to traditional methods.
It's more specific than the normal CT, MRI, the bone scan, and ultrasound.
Using a case study from Trinidad, radiologist Dr. Fidel Rampasad explained that this allowed smaller amounts of the disease to be detected where they were missed using traditional methods of imaging.
That's where the beauty of PSMA is. So patient would have had to do a CT and a bone scan, whereas he can now do one scan. So one is like a one-stop shop.
Oncologist Dr. Nazreen Bim says the scan enabled them to detect bone metastasis, allowing the patient to go on to systemic therapy.
Basically, what it allows us to do is tailor treatment to these patients. So again, this 55-year-old male was able to go on to systemic treatment. And basically, if he does have good control and a follow-up PSMA PET, then we can look at delivering definitive treatment or consolidative treatment to the primary or even those metastatic deposits. It gives him an overall longer progression-free survival than if we didn't do that.
Chairman of the Imaging Center, Dr. Jacob Hadid, says while the scans cost between $6,000 to $15,000, they are able to provide it at half the cost to patients through subsidies from the private sector. Rashad Khan, CNC3 News.
Wellness Wednesday, brought to you by BioStrath. Get what you need naturally.